Before we begin, I want you to picture something. It's early morning, the house is quiet. You reach for a small bottle in your medicine cabinet, the same one you've reached for 100 times. You take the pill with a sip of water and you don't think twice, because it's normal. Because it's common. Because someone once told you it was safe. Now here's the question that stops cardiologists cold. What if that familiar pill isn't protecting you at all? What if it's quietly stressing your heart every single day? Not with a dramatic warning, not with sharp pain, but with subtle changes you might blame on aging. A little more swelling in the ankles, a little more fatigue, a little more dizziness when you stand up, a little less breath when you climb the stairs. And then one day, something happens. An ER visit, a new diagnosis, a fall, a sudden decline that feels like it came out of nowhere. Cardiologists have been sounding alarms about this for years, and the reason it matters so much for older adults is simple. The body you have at 70 is not the body you had at 50. Kidneys filter more slowly. Blood vessels stiffen. The heart becomes less forgiving. And medications that were once tolerated can become risky. Not because the drug changed, but because your body did. That's why today I want to walk you through the real-world, evidence-backed danger of certain common pills in older adults, especially how they can damage the heart directly or indirectly. And I am going to explain it the way I would if you were sitting across from me in a clinic room, worried, confused, and trying to make sense of symptoms no one has connected yet. Let us start with the one that S in almost every home, over-the-counter pain pills, NSAIDs like ibuprofen and naproxen. These medications are everywhere because they work. Arthritis flares up, you take one. Your back aches, you take one. Your knee hurts, you take one. The problem is that NSAIDs don't only reduce pain and inflammation. They also affect how your kidneys handle blood flow, salt, and water. When the kidneys are pushed even slightly off balance, the body can start retaining fluid. That extra fluid raises blood pressure and increases the workload on the heart. For a younger person with healthy kidneys, the body often compensates. For an older adult, especially someone with high blood pressure, heart disease, or borderline kidney function, this can be the beginning of a slow, quiet storm. This isn't speculation. In 2015, the US FDA strengthened warnings that non-aspirin NSAIDs can increase the risk of heart attack and stroke, and that this risk can occur early and may rise with higher doses or longer use. That alone should make every older adult pause, because many people take these pills as needed, but the need becomes daily, then weekly, then constant. And here is something even more specific and frightening. A classic study in JAMA Internal Medicine found that elderly patients taking diuretics who used NSAIDs had about a twofold increased risk of hospitalization for congestive heart failure. Think about that. Many older adults take a diuretic for blood pressure or heart failure, then take ibuprofen for joint pain, and the combination can quietly push them toward a heart failure crisis. Now, I want you to hear this clearly. I'm not saying never take an NSAID. There are times when they are appropriate, but older adults deserve to know the price of casual, frequent use. Because the warning signs, mild swelling, fatigue, shortness of breath, are the same symptoms people often dismiss as, "I'm just getting older." And that's how danger hides. It disguises itself as normal aging. Now let us talk about another category that doesn't sound like heart medicine at all. Sedatives and anti-anxiety medications, benzodiazepines. For many older adults, these pills feel like relief in a bottle. Sleep finally comes, anxiety finally quiets, the mind finally stops racing. But the calm they create comes from slowing the brain and nervous system, and in older bodies, that slowing can go too far. The American Geriatrics Society, Beer's criteria, one of the most widely used references for potentially inappropriate medications in older adults, states plainly that benzodiazepines increase the risk of cognitive impairment, delirium, falls, and fractures in older adults. That's not a minor warning. A fall at 70 can be life-altering, and the statistics are heartbreaking. The CDC reports that falls are the leading cause of injury among adults 65 and older, and that over 14 million, about 1 in 4, older adults report falling each year. Here's what cardiologists see. An older adult takes a sedative at night, wakes up groggy, gets up to use the bathroom, and falls. The fall may cause a fracture, a head injury, or a hospitalization. And hospitalization itself can trigger a cascade: deconditioning, confusion, reduced mobility, and yes, increase strain on the cardiovascular system. But it doesn't stop at falls. Sedatives can worsen nighttime breathing, especially in people with sleep apnea or underlying heart disease. Poor oxygen levels during sleep stress the heart and can worsen rhythm problems over time. That's part of why these medications deserve extra caution, especially in anyone with cardiac history. And what about dementia risk? You may have heard alarming headlines. The honest truth is that research has been mixed and complicated. Some analyses have reported higher dementia risk in long-term users, while other reviews note limitations and potential bias. I'm telling you this because I don't want fear. I want clarity. The stronger, more consistent evidence is about falls, fractures, confusion, and dependence. And those alone are enough reason to have a careful, supervised conversation with your doctor. Never a sudden stop, never a self-directed taper. Now, let's move to a medication millions of seniors take for heartburn and reflux, proton pump inhibitors, often called PPIs. These drugs can feel like miracles. The burning stops, the sour taste disappears. You can eat without discomfort. But PPIs reduce stomach acid, and stomach acid isn't just annoying. It helps the body absorb key minerals, especially magnesium. In 2011, the FDA warned that long-term PPI use, often longer than 1 year, may cause low magnesium levels. And in about 1/4 of cases reviewed, magnesium supplementation alone didn't correct it, and the PPI had to be discontinued. Why does this matter for the heart? Because magnesium helps stabilize the electrical system of the heart. When magnesium drops, some people experience palpitations, weakness, tremors, dizziness, or abnormal heart rhythms. In older adults who already take diuretics or heart medications, the risk of electrolyte imbalance can be even higher, which is why monitoring becomes so important. Again, the danger is how quietly it presents. Low magnesium doesn't announce itself with a siren, it whispers. And many older adults interpret those whispers as, "I'm just tired these days." Now let us talk about something that sounds reassuring: heart and blood pressure medications. Because even these can become risky when doses or combinations no longer match an aging body. The goal of heart medications is protection: lower blood pressure, reduce strain, prevent strokes, improve survival. Many are truly life-saving. But the older the body, the narrower the margin between helpful and too much. Diuretics can dehydrate, electrolytes can drop, blood pressure can fall too low. Beta blockers can slow heart rate so much that someone becomes weak, short of breath, or unable to tolerate activity. And when that happens, what do many people assume? They assume their heart is getting worse. Or they assume age is finally catching up. But sometimes it's not the disease progressing. It's the treatment needing adjustment. This is why modern heart failure guidelines emphasize careful management of congestion, kidney function, and the overall medication plan, especially because older adults are more vulnerable to electrolyte abnormalities and medication side effects. The message isn't stop taking your heart meds. The message is your medications are not a set it and forget it system. They must be reviewed as the body changes. Now we arrive at what cardiologists increasingly describe as the most dangerous pill for older adults. It isn't one pill, it's all of them together. Polypharmacy, often defined as taking 5 or more prescription medications, has surged over the past 2 decades. A 2024 JAMA report found that more than 4 out of every 10 adults aged 65 or older reported using 5 or more prescription medications in the prior 30 days, 2017-2020, up from about 24% in 1999-2000. That's not a small change. That's a tidal shift in how seniors are medicated. And real-world reporting has been sounding the alarm too. Recent coverage has highlighted older adults taking extremely high numbers of medications, where side effects can mimic dementia trigger falls and cause dangerous interactions until a professional medication review dramatically reduces the burden. Here's why this becomes a heart issue. Every additional medication increases the likelihood of side effects, and every combination increases the chance of interactions. Blood pressure may swing, heart rate may drop, fluid balance can shift, electrolytes can destabilize, kidneys may be overwhelmed, and the symptoms, fatigue, confusion, weakness, dizziness, can look exactly like aging. That is the cruelest part. Polypharmacy can steal your independence while convincing you it's just time doing what time does. And sometimes, the saddest pattern appears. One medication causes a symptom, then another medication is added to treat that symptom. then another for the side effect of the second. This is called a prescribing cascade, and it is one of the most common reasons seniors end up on medication lists that no one fully reevaluates. So what should you do with this information without spiraling into fear? You do not stop medication suddenly. You do not throw anything away. You do not test what happens by quitting cold turkey. You do something far more powerful. You schedule a medication review. You bring every prescription, every over-the-counter pill, every supplement. You ask your clinician or pharmacist to walk through them one by one. You ask which ones are still necessary, which ones can be reduced, which ones interact, which ones should be monitored more closely. Because the goal is not perfect numbers on a chart. The goal is you, your energy, your steadiness, your clarity, your ability to live without fear of the next fall, the next hospitalization, the next sudden decline. And if you're listening to me right now and thinking, this feels personal, I want you to know, that's not an accident. Heart health in older age is personal. It's your life, your family, your routines, your independence. So here's my quiet request to you. The way I say it in the calmest voice in the room. Don't assume that common means harmless. Don't assume that I've taken it for years means it can hurt me now. The body changes. The risk changes. And wise care means adjusting with it. If this helped you, stay close. Subscribe if you want more guidance like this because your health deserves information that's honest, human, and practical. And if someone came to mind while you listened, a parent, a spouse, a friend, share this with them, not to scare them, to protect them. Because sometimes, the most life-saving thing isn't a new medication. Sometimes it's finally asking the right question about the ones you already take.